Do you have medication?
Mental illness is a big issue in our society, especially if you live in remote communities like Nguiu on Bathurst Island in the Arafura Sea.
Tablets to take
Every night.
Tablets to
Night and night.
for voices.
For voices, singing voices.
In early 2000, the area recorded 10 times the national average rate of suicides. In response to this, the community developed a homegrown health initiative.
Instead of talking about the sickness, we're trying to have this place talk about good mental health, see how it's going to help our people get well.
They came up with the Wellbeing Centre, based on a philosophy that provides a combination of modern and traditional knowledge.
It's going to help our people get well and help them take their medication to stay strong.
Now, while you're here, do you want to have your flu shot?
Julie, a clinical nurse, and Kathy, a local health worker, have high hopes for this new centre.
It was set up to destigmatise mental health in the community, to make it more accessible, but also look at it before it becomes a problem. So it's also a preventative strategy.
What keeps you strong?
Point which way you...
Key to that strategy is getting clients to talk about their feelings.
At bush.
What do you do? What are you walking? Do you walk around?
Sometimes exercise.
Wow, visiting family.
Visiting family.
To country. It makes you feel good, connecting with the land and the sea.
And that's exactly what Lizzie, another health worker from the centre, has planned for today.
Taking them out to the bush to help them feel better.
Charlene, who suffers from schizophrenia and depression, often feels lonely and confused.
They forgot what they used to do. You know, get them back on track again.
Xavier! Come on, Xavier!
Across town, Danny, another health worker, is picking up the men who are going to spend a day at the beach.
Bush is just like a medicine, good medicine for us. Now we feel good about in the bush, like freedom.
A freedom that comes from being out in the bush with friends doing what they love most. The men are going fishing, and the women are looking for natural dyes for basket weaving.
We're looking for the dye for the pendanus. It's a root.
What's the one now?
I got the big one. When I'm at home, I feel sleeping, but whenever the bush, I feel all right.
You can smell the bushes, nice, come out, yeah.
For the men, just being out here is making all the difference. And as they begin to concentrate on fishing, the voices grow quiet and disappear.
You can see it and hearing from our clients is they feel better coming out, and it makes our program more easy. Understand them.
I'm happy.
Meanwhile, at the Wellbeing Centre, clients drop in to be treated in a relaxed, home-like environment.
It breaks down that stigma of it being an illness, so it's a much more friendly environment. They can have a cup of tea and relax while they're doing this. If we can do it here, it makes it less stressful for them. It also gives the opportunity for the health workers to have a more informal assessment completed. They find it much easier.
And this holistic care extends to home visits for patients who can't make it to the centre.
Trying to, I suppose, take the stigma away from mental health being an illness so that it gives people a better understanding that it's just part of who they are and that it can be managed in a lot of ways rather than a medical model.
Today, Julie's visiting Crystal to monitor her ongoing recovery and medication.
Is it all right if we come in? We can just...
Yeah, come in.
Yeah?
My husband went about it anyway, so...
So we just wanted to check how things were going.
Yeah, everything's going okay.
If you're back onto that medication.
Yes, I am back on the medication.
Yes.
I'm not suicidal or anything like that, but you know, sometimes when you're in depression, you have those feelings of suicide, and sometimes that when you miss out on medication, never miss out on medication, because it is very, very, very bad if you do.
Mental health is a really important part of someone's life, and I think that's what this clinic does.
Charlene's finally made it to the beach, and with the billy boiling, Kathy uses the relaxed atmosphere to run her unique counselling sessions.
So what's on your mind today?
Feel all right, yeah. It's a good thing to remember.
It brings back a lot of good memory for Charlene when she was a child.
At day's end, the men haven't caught any fish, but their spirits are high again.
And then what? We're gonna have laugh. All part of a recovery for our clients.
For Charlene, it's been a day of connecting with friends in the bush and an important opportunity to talk about things that matter.